march to the university baseball field for an injured player. Upon arrival, you are escorted to the dugout where the player is sitting up, complaining of the chest pain and shortness of breath. He was in the batter's box when he was struck in the left side of the chest with a 90-mile-an-hour fastball.
Struck in the left side?
Yes.
Okay. Okay. PPE. Is my scene safe?
Yes.
Okay. Mechanism of injury appears to be blunt force trauma to the chest from baseball. It seems I have one patient, is that correct?
Yep.
Okay, at this time I am not going to consider ALS backup. And I don't think C-spine immobilization will be needed. Okay, I come to the patient. My general impression is of a young man who is sitting upright. Chief complaint, pain in the left side. Is that correct?
Yep, left-sided chest pain.
Okay. My patient appears responsive, alert and responsive.
Yep, he is also only using 2 to 3 worded answers.
Okay. All right.
He's also in the chief complaint is shortness of breath, by the way.
Shortness of breath. Okay, great. So assessing his his airway, I'll open his airway and look in there. Is his airway open and patent?
Yes.
Okay. So I won't need an airway adjunct. Looking at his breathing, he appears to be breathing but short of breath. Does he have adequate chest rise and fall? Is it equal bilaterally?
Left side of chest is diminished rise and fall.
Diminished rise and fall on the left side. Okay, I'm going to listen to his lung sounds now then. What do I have for lung sounds?
Clear, slightly diminished on the left side.
Okay, slightly diminished on the left side. I'm going to go ahead and put him on oxygen, given his diminished breath sounds. I am checking his circulation, so I'm feeling for his pulse in each side here. What do I find for pulse?
For pulse, you have 122 beats a minute.
So rapid pulse, okay. His skin condition, warm, pink, dry, moist. What do I have?
Pale, cool, diaphoretic.
Pale, cool, diaphoretic. Okay, I'm going to lay him down and treat him for shock. So he's on oxygen. I'm going to try and keep him warm. Diminished left side. I'm gonna transport and call ALS for intercept and get him on the ambulance. I will take a quick sample history. So signs and symptoms.
Acute onset of left-sided chest pain and shortness of breath.
Okay. Any allergies?
Penicillin.
Allergic to penicillin. Medications or other drugs?
None.
Okay. Any medical history that we need to be aware of?
None.
Okay. What did you have last to eat or drink and when?
Just dinner 2 hours ago.
Okay. And what were the events leading up to the incident?
Struck in the left chest with a baseball.
Okay. I'm going to take blood pressure. What do I get? Sorry. Go ahead. Go ahead. What do I get for blood pressure?
95/60.
Okay, so we're on the low side here. Okay, I'm checking his pupils. How are his pupils?
Pearl.
Okay, great. I'm going to expose the patient and perform my secondary assessment here. So quickly, I'm palpating the head. Do I feel any deformation, crepitus, swelling?
Sorry, I'm trying to find it. It's hiding from me. No injuries noted for the head.
Okay. I'm looking for battle signs behind the ears. Anything from the nose or ears?
None noted.
Okay. I'm checking his. I'm palpating his neck. Again. Do I feel anything in his neck? Any deviation or anything?
None noted.
Okay. No JVD. No tracheal shift.
Nope.
Okay.
Slight JVD.
Slight JVD. He is supine, but still a little concerning. Okay. So I'm going to palpate the chest gently. Start at the shoulders, feeling around. I'm feeling the sides of his chest. Do I feel any paradoxical movement? Is there pain, tenderness in his chest? Left side, I'm assuming.
So, rapid assessment reveals possible rib fractures on the left side, bruising and tenderness over the left ribs,
Okay.
and breath sounds are diminished on the left side.
Okay. All right. I still have him on oxygen, non-rebreather, 15 liters a minute. I'm palpating his chest. Do I feel any firmness? Is there any tenderness?
Just the tenderness over the left ribs.
Did I say chest? I'm sorry, abdomen.
Abdomen, okay, sorry. Stable pelvis,
Okay.
abdomen soft and non-tender in all 4 quadrants.
Okay. I check his genitals, pelvis, nothing noted. I
No genital injury.
move on to his legs. I'm feeling for pedal pulses. I ask him to push, check PMS, push on my hands, if he can feel me touching his toes. Do I have PMS in both legs?
It does not say, so I assume so.
Okay. And nothing noted in terms of injuries?
Nothing noted.
Okay. Upper extremities the same. I'm checking for PMS in both upper and checking for any injuries in his upper extremities.
Same situation. Nothing noted, so I assume.
Okay. Okay. I am going to gently roll the patient and examine his spine, his thoracic and lumbar spine, his posterior and buttocks. Anything noted there?
No injuries noted.
Okay. Great. I think in terms of assessments, I am done. I'm going to take another set of vitals. Are there secondary vitals listed? So I'm going to take blood pressure again.
Blood pressure changed to 90 over 58.
90 over 58, so decreasing slightly. Okay, his pulse.
Pulse is 128.
Okay, and his respiratory rate.
Respiratory rate is 28.
28. Okay, I am going to continue to treat him for shock. I'm going to keep him on oxygen and get him to the hospital, and I will continue to reassess every 5 minutes, being ready to ventilate as needed and carefully, because I suspect a come on, Miller. Pneumothorax. So I'm going to get him to the hospital as quickly as possible and continue to assess vitals, being ready to assist in CPR or PPV as needed. And I think I'm done.
Okay, good job.
Thank you.
You're welcome.